Electromyography. Nerve conduction studies provide objective evidence of motor unit dysfunction in patients with weakness, localize and characterize lesions of peripheral nerves, differentiate peripheral neuropathies from myopathies, neuromuscular junction transmission defects, and motor neuron diseases, detect subclinically abnormal nerves, provide early detection of peripheral diseases, and identify and characterize patterns of anomalous innervation. Motor nerve conduction studies involve stimulating a peripheral nerve and recording from a muscle innervated by that nerve. Sensory nerve conduction studies are made by stimulating a mixed motor sensory nerve and recording from a cutaneous sensory nerve, or vice versa. The amplitude, duration, shape, and latency of compound muscle action potentials, CMAPs, and sensory nerve action potentials, SNAPs, are noted. Responses at 2 or more recording sites are compared, and distal latencies and conduction velocities are determined. The effect of repetitive stimulation, exercise and rest, and drugs may be also studied. Nerve conduction norms vary with body temperature and age. The F wave is a muscle action potential resulting from a supramaximal stimulus of a motor nerve that leads to an antidromic action potential that reaches the alpha motor neuron and then to generation of a second orthodromic action potential. An F wave is recorded as a low amplitude muscle action potential occurring after the initial CMAP, an M wave, and is a means of evaluating proximal motor nerves. The F wave latency is prolonged in neuropathies with proximal involvement such as Guillain-Barré syndrome and diabetic neuropathy. It is also prolonged in radiculopathy, some hereditary neuropathies, and motor neuron disease. The H wave is a muscle action potential resulting from submaximal stimulation of a monosynaptic reflex arc with the large diameter sensory nerves as afferents. Because of practical and anatomic considerations, the tibial H reflex, dorsal and ventral roots of the first sacral nerve, S1, is the only one typically recorded. Thus, the H reflex is the electrical equivalent of the ankle reflex, and the response disappears in peripheral neuropathies or S1 radiculopathy. The H reflex can be normally absent in persons over the age of 60. Repetitive stimulation is used to confirm and differentiate defects of neuromuscular transmission. With slow repetitive stimulation, 2 to 5 Hertz, a CMP amplitude decrement of more than 10% is seen in myasthenia and Lambert-Eaton syndrome. This decrement improves immediately after exercise and worsens 2 to 4 minutes later. With fast repetitive stimulation, 30 to 50 Hertz, a CMAP amplitude increment of more than 100% can be seen in a presynaptic disorder such as Lambert-Eaton syndrome and botulism. The electromyographic needle examinations records electrical activity in muscle, yielding information on the nature and location of motor unit disorders. Changes in insertional, spontaneous, and voluntary activity may help in differential diagnosis. Abnormalities on needle examination may occur in many combinations. No single abnormality is specific for a given disease. Myopathic processes, especially inflammatory myopathies, are generally associated with increased insertional and spontaneous activity. Motor unit, potential amplitude, and duration are decreased, and the percentage of polyphasic potentials is increased. Recruitment may be early. In several myopathies, recruitment may be decreased. In some endocrine and metabolic myopathies, EMG abnormalities may be minimal or absent. During the first week, neurogenic lesions are associated with normal insertional and spontaneous activity. Motor unit potentials have a normal appearance, but recruitment is decreased. Within 2 to 3 weeks, insertional activity and then fibrillation potentials appear. With reinnervation, spontaneous activity decreases. Short duration polyphasic motor unit potentials appear, and recruitment improves. Variation in motor unit potentials may be noted. In chronic neurogenic disorders, motor unit potential amplitude and duration are increased, and the percentage of polyphasic potentials is increased. And that is electromyography. Have a great day.